Hello and welcome once again to our Doctors Roundtable. India has scaled a significant milestone this week in the fight against COVID-19. 100 crore vaccines administered and counting. As the COVID numbers also remain mostly under control, the big question that's being asked, is the worst of the pandemic now over? When can we return to a normal life? What are the potential speed breakers that could still lie ahead? Joining me now is a stellar panel of some of the country's top doctors. Dr. Shahid Jamil, eminent virologist. Dr. Hemant Thakkar, one of Mumbai's leading physicians. Dr. Subramaniam Swaminathan, Director Infectious Diseases at Gleneagles Global Health City. Dr. Anupam Sibal, pediatrician and at Apollo Hospital. Thank you all very much for joining me here on the show today. But first, before I come to you for all the questions, remember that viewers are putting in on this big subject. Let's listen in to Prime Minister Modi as he celebrates that landmark 100 crore vaccinations.
21 अक्टूबर को भारत ने 1 बिलियन 100 करोड़ वैक्सीन डोज का कठिन लेकिन असाधारण लक्ष्य प्राप्त किया है। इस उपलब्धि के पीछे 130 करोड़ देशवासियों की कर्तव्य शक्ति लगी है। इसलिए ये सफलता भारत की सफलता है, हर देशवासी की सफलता है। मैं इसके लिए सभी देशवासियों को हृदय से बधाई देता हूं। भारत ने अपने 100 करोड़ वैक्सीन डोज लगाई हैं और वो भी मुफ्त, बिना पैसा लिए। साथियों, 100 करोड़ वैक्सीन डोज का एक प्रभाव ये भी होगा कि दुनिया अब भारत को कोरोना से ज्यादा सुरक्षित मानेगी। एक फार्मा हब के रूप में भारत को दुनिया में जो स्वीकृति मिली हुई है, उसे और मजबूती मिलेगी। पूरा विश्व आज भारत की इस ताकत को देख रहा है, महसूस कर रहा है।
So the Prime Minister there speaking on that 100 crore milestone being reached. But the questions are still there. And the first question that I want to take on the Doctors Roundtable is the worst of the pandemic over? Dr. Swaminathan, as an infectious disease specialist, why don't you take that? Is the worst of the pandemic over? Can we say that with certainty?
Well, good news is it looks like that. Obviously, the bad news is there's going to be a long tail, but the good news is, given the effort that's gone into vaccination, I don't see a significant wave coming up in the near future. So I think the worst is behind us.
Let me add a question to that. Looking at the numbers, active cases 1,75,745, which is the lowest in 232 days. Daily positivity rate at 1.19%, less than 3% for 53 consecutive days. Weekly positivity rate currently at 1.31%. Deaths so far 4.5 lakhs, but clearly it appears to be under control. So let me add to that question. Will there be a third wave at all now? Dr. Shahid Jamil, do you believe there will be a third wave at all now? Or will it be milder?
I think it's highly unlikely, Rajdeep, for the same reason that Dr. Subramaniam just cited. Plus, remember that the ICMR 4th Zero survey showed almost 2 months back that 67% of Indians had already been exposed. So we had a massive second wave, which is also leading to the protection in addition to the vaccines. But, you know, looking at what happened in Kerala during the festive season, what happened in Bengal just after Puja, I think we need to be a little careful in the festive season coming ahead. But yes, I believe the worst is over.
Are you saying, therefore, that it's become endemic? Just let me push you on that. Are you suggesting, as Dr. Gagandeep Kang told us earlier this week, that the virus could have become endemic in India?
Well, the virus is on the way to becoming endemic. You know, it's like saying that at every birthday, I get 1 year closer to death. Well, that's true. So it's on the way to endemicity. But I wouldn't say that the virus is just endemic just as yet. Remember, about 25% Indians adults remain to be vaccinated. And that is the next challenge that we have to overcome.
Right. That's a very significant point that you're making, that you still have a large percentage of adult Indians who are yet to be vaccinated. Double vaccinated in particular is still also a big challenge. You mentioned festivals, Dr. Jameel. Let me take that to you, Dr. Thakkar, because in a week or 10 days from now, we'll be in complete Diwali mood. Much of India is already getting into festive mood. I've asked you this in the past, but given what you've just heard, can we really celebrate Diwali this time in the way that we traditionally do? Would you suggest that we go ahead and celebrate Diwali almost as if it's the end of the pandemic?
It's not the end of the pandemic. 2/3 of the pandemic is already negotiated, but we still have another 1/3 to go. And if we let our guard down, and if we celebrate this Diwali, we may not be able to celebrate festivals next year. Remember, how we behave now for the next 4 to 5 months will dictate how the virus behaves after that. Because our behavior will help us to tame the virus. I already think, and my article on Dasara Day clearly said that we have entered the endemic stage. But to stay and to burrow and to dig into the endemic stage, we have to be extremely careful. We probably, instead of meeting 4 people, can meet 6 or 8 this Diwali, but you cannot celebrate the traditional Diwali. We have negotiated Ganpati, we have negotiated Dasara, probably the puja at West Bengal. We have one more large festival to negotiate, by which time we are rapidly vaccinating, the virus is rapidly infecting, so the numbers are increasing, and that's what's giving us immunity. So till the virus and we can cohabit, where the virus is dwindling and we are living with small peaks and troughs, which makes it endemic, we'll have to be careful. So this Diwali will still be a subdued Diwali.
Very quickly, just to add to that, are you saying no big Diwali parties to be held at home? Are you saying don't have your traditional, someone in the family is getting married, don't have the usual band, baja, barat? Are you re-emphasizing that, Dr. Thakkar?
I'm saying that they have relaxed the norms from 25 people to 50 people. You can go up to 70 people. But what's the hurry for this big Diwali party? You can celebrate in the new year when we would have negotiated most of the festivals. You do not want to give this nasty virus a chance to mutate. We've got it by the scruff of its neck. Let's squash it. Let it learn to live with us at our terms and not us at its terms. And therefore, I would say caution is the need of the hour. We have negotiated 2/3 of the jungle.
Right.
I can see the light at the end of the jungle, but it's not that close as you make it out to be.
I will just press you one more time, because a lot of viewers are asking, Dr. Thakkar, what is the ideal number of people, therefore, that if I want to have a Diwali party at home that I can invite? Is there an ideal number?
If you live in a garden, you can have 50 people.
Okay.
But if you live in a house like all of us do in Mumbai, you must have all your vaccinated friends not exceeding 5 to 6 couples. This is what I would feel. Unless you have a big, large terrace flat, what's the risk? Have 3 Diwali parties of 10 people each. You can wait for a little longer time because you can smell the victory. There is no finite number I can give you, but common sense has to prevail, because you don't want to lose this opportunity. And we've all agreed amongst ourselves that there is no third wave coming. So let's extinguish this virus completely before we let our guard down.
Okay, no third wave coming, which brings me to some more questions that are coming in this time about schools. And Dr. Sibal, who better than you to take the question about school? Are children safe once parents and teachers are double vaccinated? Has the time come for all schools now to almost fully open up? And colleges?
Good evening, Rajdeep. Pleasure to be on your show. Well, I think what's worked well for us in India, one is, of course, the massive second wave. The fact that vaccines worked against the Delta variant, and we've seen evidence to that. And the fact that even if you don't have two vaccines, but have had one vaccine, you do get significant protection. And that's why we are where we are with 15,000 cases. Now, kids have really suffered a lot. I mean, one is, of course, missing school education, but it's also emotional. We also have had medical issues come up, with obesity, a lot of weight gain, constipation, what have you, the eyes, the strain that they have. So, they need to mingle with kids their age. So we need to encourage kids to get back to school. Parents also today have a comfort level that they did not have 8 weeks ago. And so they're open to that, and to use the terminology that you quite often use because you love cricket. We must do this without letting the guard down. So it's not like you open all schools. And you also have to be very vigilant. If we see numbers increase in a particular region, we're going to have to scale down and go back to hybrid or go totally online. So it's not going to be, it's going to be dynamic. It can't be static. It can't be, okay, we've opened things, so that's the way it is. But we need to move towards opening schools.
No, you're saying move towards opening school. Let me just press you. Should children visit schools only after they are vaccinated, after we start a significant program for vaccination for children, and particularly also for young teenagers between the age of 13 and 18? Should colleges open there? What's your view? I mean, how do you decide this college can open, this school can open, and the other cannot?
Right. So colleges is fine because everyone over 18, of course, junior college in Bombay is a different situation, but college is usually over 18. So opening colleges is not a problem. Now, as regards linking vaccination to school opening, I don't think we can do that. For the simple reason that our priority still is getting all the adults vaccinated and everybody getting 2 shots. Then we will start vaccinating kids with comorbidities, those with hematological conditions, malignancy, liver disease, kidney disease, and so on. So a healthy 8-year-old, it's going to be a while before a healthy 6 or a 10-year or a 12 or a 14-year-old is going to get a vaccine. And I don't think we should keep them off school for so many months because it is going to roll well into the next year.
Right. So the key really is to get actually parents vaccinated, teachers vaccinated, ensure that every teacher in the school is vaccinated, social distancing norms in school. Dr. Swaminathan, you said at the very outset, triggered this off by saying that the worst is possibly over, hinted that there will be no third wave. But we've seen new outbreaks in China this week, United Kingdom cases rising. Should we be worried? And an additional question to that being asked is, can Delta Plus or this new AY 4.2 subvariant trigger a wave in India?
See, we need to understand that everybody is talking about it going on the way to endemicity. So let's look at influenza. H1N1, every year we get a few cases happening again and again. Does that paralyze us or stop life? The answer is no. I think it may end up that COVID also goes the same way, in which case there will be smattering of cases coming up every year. So that could be what we look at as waves. Whether we choose to call it that way or another way is fine. But it is inevitable is what I can see.
And will that be more localized? Will that be more localized, Dr. Swaminathan? No. Do you see now? Because I was in Mumbai the other day and there were a couple of buildings which had, outside their buildings, there were posters saying there are COVID cases in this building. These were all high-rise buildings.
Look at what's happening in Africa and South America. The majority of that areas have not even had a single dose of vaccine. So if you look at it globally, it's still a drop in the bucket. That's the unfortunate truth. So till the rest of the world gets vaccinated, there's always a chance of it going around and coming around. Second thing is, mutations and change is inevitable. Flu does that every year. Why should COVID be different? Please understand that just because we find a mutant doesn't mean it's a problem. The Delta is the case in point. We identified Delta October of last year. And when did it trip us a new one? April of this year, or maybe March of this year. So just because you find a mutant does not mean it's going to rip you a new one immediately. There are a lot of factors which go into it, both in terms of mitigation and also in terms of severity. Now, the best thing we can do is vaccinate. And that we've done very, very aggressively. That's the reason why I believe that even if we do have a new wave, it is going to be so mild that it's not going to tax the system as it did this year. And second thing is that this kind of viral illnesses will be practically indistinguishable from the viral illnesses that we see with the seasonal flu spikes. So we may see a larger spike than usual because of the flu and this put together, but not.
That is extremely reassuring to hear. Let me come for a moment to my other guests for many more questions that are coming in at this moment. Booster vaccine doses. Dr. Jamil, booster vaccine doses, will they be needed? A number of people believe that sooner or later we will have to go in for a booster, even those who are double vaccinated, to ensure that the immunity is even greater than it is today. Do we need a booster vaccine dose? Dr. Thakkar?
So, yes, I think eventually.
Yes, Dr. Jamil. Go ahead, Dr. Jamil.
But is the time now in India to give booster doses? I don't think so. I think the focus in India has to be to get all those people who have one dose to take the second dose, and all those who have not had any dose to take one dose and 2 doses. And then we may start doing boosters, starting with more vulnerable populations, like the elderly, like people who have other comorbidities. There is this thinking that the antibody levels go down and therefore boosters are needed. But so far, we don't really know what the correlates of protection are. What is the level of antibody that will protect? We are not even talking about T cells and their role in protection.
That's an interesting.
So,
Dr. Jamil, do you believe therefore that we need to, and this is a question being asked by someone from Chennai, should I keep checking antibody levels?
No, I don't think so. I think that's what I was saying. We don't know whether 100 international units protects or 10 protects. We don't know that. So you're going to be simply spending a lot of money and worrying yourself to death. Don't do that. You have been vaccinated fully. Continue to protect yourself. Use common sense, but it doesn't mean that you should stop living. We are thankfully in India at a stage where we can go about our normal activity, but go about it with caution and do that.
How common though, Dr. Jamil, and this is a question that is being asked, how common are infections among fully vaccinated and those who've got COVID before? There's been much talk about breakthrough infections. Do you believe that that is a serious challenge going ahead at all?
I don't think it's a serious challenge. The thing is that individual cases are pointed out in the media, and we lose track of what is happening to populations. Yes, reinfections will happen because these vaccines are not designed to protect against infection. They are designed to protect against severe disease and mortality. So reinfections will happen, but what the data shows is that reinfections in people who are fully vaccinated are really, really low. It's somewhere around the range of 1 to 1.5%.
Okay, so, I am, in all the months that we've done a doctor's roundtable, first time getting such reassuring messages from all of you. It almost seems that there is light finally at the end of the tunnel. Dr. Thakkar, after effects and long COVID, we've discussed this in the past and it was a big concern. Someone has written in, what are the COVID after effects that I should still be worried about? I had COVID, I feel a sense of fatigue and also hair loss. Are these concerns that should be looked at, Dr. Thakkar? Are you getting a lot of patients with long COVID?
So we're getting people with complaints like hair loss very, very commonly, like they get hair loss after dengue fever. Even after dengue fever, they have hair loss, which they have after COVID. The question of fatigue, how much of fatigue is real and how much is in the mind, we need to segregate. By long COVID, we as doctors really worry about the breathing problems, the destruction of respiratory tree, which needs to be mended, and the loss or fibrosis in the lungs. Maybe the possibility of recurrent thromboembolic events because of clotting. So if you have had a patient who has comorbidities, we still keep them on blood thinners for a little longer or maybe much longer period of time. We give them respiratory exercises and if required drugs to see the compliance of the lungs is better. But weakness and hair loss really don't worry us so much because they are more subjective as compared to objective symptoms. The only treatment for that is good vitamins, healthy living, and you have to emphasize very clearly that just because you have COVID doesn't mean you don't need to wear a mask.
But should I?
Doesn't mean that you
Yes. That's an important part. Can I stop wearing masks or not, Doctor? Dr. Thakkar? No?
How can you stop? I've got right now 11 patients admitted in the hospital, and of these 11, 10 of them have been vaccinated. One person had COVID 18 months ago. But that doesn't mean that if you had COVID, you don't need to wear a mask. And as my colleague rightly pointed out, it's like flu. If I've taken the flu shot, doesn't mean I'll never get flu. I'll get a milder variety. None of them are on ventilators. None of them are on oxygen. They are mild symptoms. And we learn to cohabit with them.
Right.
And one day WHO just might say, oh, you have COVID, rest at home for 5 days and then come to office after that. That's the day I'm looking forward to. I don't want to take away 14 days.
Right.
We've already got now a 10-day limit. So we'll probably bring down the limit once we become endemic.
But for now, you've got to continue to wear masks. Till further notice is what the doctors seem to be suggesting. You've got to wear masks. Dr. Sibal, one of the other issues which is coming out is multi-system inflammatory syndrome among children. Are hospitals still reporting it? Are you still getting cases of that? Should parents be worried?
Yeah, so, as was pointed out earlier, sometimes we look at isolated cases and get really worried. Okay, MISC, I think too much media attention, too much concern, very worried parents, okay, less than 1% MISC, seen more in the West than in India. And this thing that we had, kids weren't infected with COVID, you look at the NCDC data, about 11% of every if you look at the total individuals infected were kids. And so, it's not that they weren't exposed or they didn't get infected. They had very mild infections because we know that they don't get into ICU, they don't get into trouble. Thank God for that. And less than 1% get MISC. So I think this focus on MISC now needs to go away. But I also wanted to make a couple of other comments on, just adding on to what Dr. Jameel and Hemant and Dr. Swaminathan have mentioned. This obsession with antibody testing has to go. Because what happens is, I think all of us end up wasting so much time on the phone and WhatsApp answering, hey, my antibody level was this 2 weeks ago, now it's this, and then you have to explain everything. So antibody is just one measure. Cell-mediated immunity, we can't measure. And even if the antibodies disappear, remember that we have the memory T cells and memory B cells, and they will actively recognize this virus and mount an immune response, and we can't measure that.
Okay.
Second thing that you mentioned about variants. Now, after all, there's a reason why the mutants are after the Greek alphabet. There are 24 letters, right? So we will keep getting mutations. We don't have to get unduly worried about mutations. There are mutations, there are variants of concern, and there are variants that we don't worry about. So I think we need to calm down about that. And the last point I wanted to make about vaccination. Now, we looked at the high-risk population of healthcare professionals at Apollo, a study that came out. We looked at 29,000 healthcare workers who'd had vaccines, and we followed them. And this was through the second wave with Delta, and we did not have more than 5% breakthrough infection. And so these are people who are looking after COVID patients.
Right. And that all of this is positive. The vaccines are clearly working. That's going now without doubt. Dr. Swaminathan, in that context, someone has sent an interesting question. This is being asked, I see in the newspapers as well. Does the flu vaccine give additional protection against COVID? We are entering a winter. People want to know, is there a flu vaccine that would give additional protection? Should they be taking it?
That would be nice. That would make a lot of lives a lot easier. Unfortunately, no. The flu vaccine is only designed to give you protection against the strains of flu A and B which do circulate and cause trouble. But in the future, you never know. Maybe they co-formulate the flu and the COVID vaccine together to make it a yearly vaccine. Anything could happen. But as of right now, unfortunately, no, the flu vaccine is not going to give you benefit. But if you're a person who is highly vulnerable, the same risk factors as COVID, for severe COVID, then the flu vaccine is something which is recommended for you and a good idea.
A link to that, Dr. Swaminathan, there are a lot of advertisements coming on these antibody cocktails that are reportedly effective in COVID treatment. Donald Trump, US President, used it. Should we be, emulating Trump at all, Dr. Swaminathan? Lots of hospitals are coming up with ads for 75,000 rupees. We'll give you an antibody cocktail.
See, everything is useful in the appropriate clinical scenario. Anything out of context is garbage. So, is the monoclonal antibody useful? See, I have used more than 160 doses in my hospital so far. And I can tell you, when it's used appropriately, it does make a meaningful difference. But point is, we can't make it something which is willy-nilly given out like prasad at a temple. Obviously, it has to be given to the right person at the right time for the right reasons at the right dose. And that's true of any medicine in today's day and age.
Right.
So yes, it's a useful part of the answer, but not an answer in itself.
Dr. Jamil, in the United States, there's much talk of mixing of vaccines. Is really mixing of vaccines as effective as it is being made out to be? If I have taken my first dose, which was Covaxin, now should I go and take Covishield or should I stick to Covaxin?
Well, in the West, they have done some studies, and those studies are based on mixing AstraZeneca vaccine or the Johnson & Johnson vaccine with the RNA vaccines.
That's right.
Which is Pfizer and Moderna. And the results do show that a combination of vaccines gives better parameters, gives better antibodies, gives better T cells. So in that sense, it helps. And there is nothing in immunology that says that mixing doses should not be done. In fact, two different types of vaccines, when they are mixed, they give you the best kind of a response.
But I've taken a double dose of Covishield. Should an mRNA vaccine be available soon? Johnson & Johnson is promising to come here soon. Should I be taking that vaccine as well as additional immunity, or are you saying that's a luxury?
Well, I mean, at this time, I think that's a luxury. But eventually, something like this will happen. And a more viable option possibly could be when boosters come around, protein vaccines will be used as boosters. Sanofi Pasteur is developing a protein vaccine, which is in phase 3. Novavax has already developed a vaccine, a protein vaccine, which is under some regulatory pressure right now.
Right.
But I think eventually it will get approved. So that will be another option. But those are for booster
You're saying those are booster?
Later. I don't think in India we need those yet.
Okay, you're saying you don't need them as yet. The other question, black fungus, is it finally over, Dr. Thakkar? Are you seeing any cases at all in hospital at all of black fungus? Is the worst of black fungus over?
Yes, I can say the worst of black fungus is over because we don't have such severe cases which we had as before. And we don't need to use such large doses. In fact, we don't use too much of steroid at all. And because of that, we don't disturb the sugar and the immunity and don't compromise the patient's chances of getting fungus infection. So I think black fungus is over and out. I don't think we need to worry about it.
Any new medicines to treat COVID, Dr. Thakkar? Are there any new medicines out there? After all the medicine that we've gone through over the last 18 months, any new magic medicine being prescribed at all?
I entirely agree with Dr. Swaminathan that Trump's cocktail is an excellent, potent, and almost foolproof way of treating COVID quickly, making the patient go home faster, making him negative easily. But it has to be done in the proper context, in the proper time, and for the proper conditions that have been enunciated. Having said that, Merck is coming out with an oral pill sooner than later called Molnupiravir. And this Molnupiravir is already entered phase 3 of study. I won't be surprised if it fast tracks its approval. When it will come to India, I don't know. But India has this uncanny knack of everything appearing pretty soon when it appears anywhere else. So that's some magic bullet which may come sooner than later.
Let's turn to an issue which is, as you all say that we are moving towards a better future, lifestyle questions that are coming in. Dr. Sibal, we briefly discussed about masks. Dr. Thakkar saying, please continue to wear your mask. Are you recommending this to all your patients cutting across age groups, whether they have comorbidities or not, Dr. Sibal, that you continue to wear your mask, even if you're in office and I'm sitting in a room alone, can I remove my mask?
So the recommendations or what we are giving out as advice to families is please be masked, maintain social distancing and hand washing. Yes, if you're sitting alone in your office and there's no one with you, you don't have to wear a mask, not a worry. But if 3 people are going to walk in unannounced, then you better have a mask, or you ask them to wait and wear your mask and keep your mask next to you. A lot of people do that. So a mask is really something like your spectacles that you have to carry now with you. There are moments you can take it off, but you'll be surprised at the kind of awareness we are seeing with kids. The other day, I had a 4-year-old who was telling his father, please wear your mask properly. And I was so impressed.
Are you telling the kids also to continue to wear masks, doctor?
Yeah, you see, the older kids are fine. It's the little ones who struggle with wearing a mask. But honestly, kids have got used to seeing everybody with masks now. So we are getting acceptance in wearing masks for kids, which I'm actually very pleasantly surprised. And I think
that's good to hear. Dr. Swaminathan, someone is asking the question, I'm fully vaccinated. Can I now go back to handshakes and hugs, or should I stick to the plain old namaskar?
Nothing wrong with namaskar. Simply
nothing wrong at all. Nothing wrong. I love it.
No, because it protects you against a lot of other things, including influenza. So, you know what? Actually, namaskar and having a distance between people is actually a good idea. See, why do you want to get too close? You don't know what else you will get from the other person beyond just COVID. So, for a lot of reasons, let's maintain our distance till we know better. And I think long term going ahead, I think physical contact restriction is going to be part of what we do on a day-to-day basis. But let's see, you never know.
Dr. Jamil, interesting question coming in. You're in Delhi like many of us, and it's winter time or winter's around the corner. Is there a link between COVID and winter? People are worried that as winter sets in, COVID cases, could they actually rise? Is there a fear? Do you at all linking it to weather patterns?
Well, Rajdeep, from the sweater that I'm wearing, you can see that I'm not in Delhi. I'm in UK, where now
you're a lucky man. You're in the United
cases
Kingdom.
are really rising.
Yes.
So winter keeps you inside.
Yes.
Winter also allows you not to open your windows. So the air is not circulating, and that is why the incidence of all respiratory diseases increase during winter. Flu comes in winter. You see higher incidence of active tuberculosis in winter. So it's really about recirculating air and fresh air getting in. So open your window as much as you can.
Are you saying from that, and this is linked to to again what you just said? Am I safer indoors or outdoors at the moment?
Outdoors, anytime.
Anytime, right? So therefore,
as far as COVID is concerned, but I'm not sure whether the risk of being indoors or being on the roads in Delhi, what's the risk factor?
That Dr. Sibal, there's a friend of mine again whose son is getting married this time. This is what happens at my age, and wants to know, should he hold the wedding in a farmhouse outdoors, or should he look for an indoor hotel venue?
Well, it's definitely better to have it open. If you can have a nice garden and organize that, that's definitely much better. Of course, we are starting to get worried about the air quality index in Delhi, which folks in Bombay don't have to worry too much about.
Yes.
So, we have that problem here. And definitely we are seeing a lot of flu. I have to say in the last 2 weeks, we are seeing a fair amount of influenza.
But not COVID related. Not COVID related. That's the regular winter influenza.
Yeah. That's right. Not COVID related, but that can play a spoiler as far as parties go for those who are planning, biggish weddings and parties like that.
Dr. Thakkar, A question coming to you from Mumbai, your city. Planning to reopen our office in Nariman Point in the first week of December. Should we follow the hybrid model or allow full attendance?
You can begin with the hybrid model and then gradually go into full attendance. Because when you start after such a long gap, you will need to break in. So try the hybrid model to begin with. Dr. Jamil is in UK, and I pity him because after a lot of vaccinations, 67% of the population vaccinated. I don't know how many waves they had, but I am happy that India can teach a lesson to UK that they opened up. We saw the Crest matches, we saw the Wimbledon matches, and they have more than 50,000 cases, and we have less than 15,000 cases.
But is that a warning somewhere in what you're saying that, during Diwali, post Diwali, should we be opening up once again, treating it as life is normal, or should we wait at least at the very least till January before we know that we can, hold these large gatherings of any kind in the country?
That's what I said right in the beginning. You have another 3-4 months to negotiate. And if you hold large gatherings, you're going to be in trouble because you have the advantage. You vaccinated, you separated, you had good lockdowns.
Right.
Britain does not want another lockdown for economic reasons, and neither can we afford it. So I would say go the hybrid model, go slow. I'm happy our government is slow in unlocking, and that's certainly helping us.
Dr. Jamil, you wanted to say something, yes?
Yes, I just wanted to add that what Dr. Thakkar says is absolutely right. I mean, UK has vaccinated almost 90% of adults.
Right.
Yet, they are touching about 50,000 cases per day here. And that's because no one wears a mask. Outside, of course, no one wears it. Indoors, it is, it's voluntary for people to wear masks on public transport and indoors. And I see maybe only about 20% wearing a mask indoors. So that is what makes the critical difference. But if I may add,
yes,
the mortality figures are way down. And that's because of the vaccine. In the second wave in UK, mortality rates were 2%.
Right.
Now mortality rates are 0.2%.
So in a way,
the difference is the vaccine.
Sure. So the vaccine protects you from hospitalization and severe disease, but wearing masks and social distancing remains essential to provide you a level of protection while the virus is still around. That's the way, perhaps, to put it. Since we spoke about masks, I don't know, Dr. Swaminathan, whether you're a singer, but is karaoke singing without masks okay? This is asked by my producer. He's a karaoke singer. Wants to know, is karaoke singing allowed without the mask?
That's a problem because singing, especially high-pitch sounds, tend to nebulize a lot more than regular talking. But I suspect that even the way Indians talk, we tend to be a little more forceful and loud with the way we talk. So I suppose even regular speech induces a lot more aerosols akin to singing in the Western world. But jokes apart, I think singing would be a concern. I would definitely encourage a mask usage for such a activity, yes.
Okay. Encourage masks while you're doing karaoke. Dr. Sibal, I'm sure a lot of your clients are saying they want to go on holidays. It's holiday time, take the kids out, get a break. What should people be keeping in mind while deciding on a tour destination? Are there particular destinations that you would say are safer than others? We saw with hill stations being packed a few months ago across Himachal, traffic jams. Do you believe there are some places safer than others?
Well, there's a lot of common sense involved in making this decision. Obviously, there are a lot of people who are heading towards Goa, and Goa is very, very popular for people who live in the north, and for many people in many parts of the country, going to the hills is where they prefer to go. But of course, that will all decrease unless you're interested in seeing the snow and so on. So it's largely going to be to warmer climates. The important point to consider is it's not so much about the location you're going to, but where you're going to stay and what are you planning to do. That's where you have to be cautious. And if you, for example, see that suddenly there's a spurt of cases, then perhaps not such a great idea going there. And of course, a point that we emphasize over and over again, that SMS is here to stay. So just because you headed out and you're on holiday and mentally I want to relax and, I want to unwind and all, but the masks are there and hand washing is there and social distancing is there, because when these are put aside, that's where the problem starts.
So even on holiday, maintain COVID protocols. Dr. Swaminathan, which is safer, metro, cabs or auto rickshaws?
So auto rickshaw has the advantage of having good open air ventilation and therefore good cross ventilation. But in a cab as well, if the driver is wearing a mask and you're the only other person and you're wearing a mask, the risk is actually not too bad. Yes, having the windows open may actually give you some advantages. But if the heat is oppressive, then it's a question of whether you want your sanity or whether you want COVID. So I guess you'll have to choose that. But yes, if you have good cross ventilation, I'm not worried about either.
Okay, this is again asked by my producer. Perhaps, he's the same one who asked about karaoke. He's asking, are discos and pubs safe now, Dr. Thakkar? Can you, close places, pubs where, people will be in close contact? How do you maintain social distancing in a pub is a huge challenge. And people, when they are drinking, will not be wearing masks. So would you advise people in small gatherings, go to discotheques or go to pubs in particular?
I'm sorry to play spoil sport for your producer and all the other pub hunters, but unless you have a pub where there is a lot of social distancing, hardly any smoke to not make you cough, I would say no pubs, certainly no discos where people are cheek by jowl. God knows what's happening inside. And having said this, in India, people wear helmets or seat belts because they don't want to pay a fine. So by the same token, people wear masks because they will be apprehended. You have to realize that you need the mask for the value of your life and not to prevent a fine.
And presumably wearing the mask above your nose, not below it like I tend to do and get myself into trouble. Am I correct?
Sooner than later, if you don't wear it properly, and if you wear a chin mask or a lip mask, you could get into serious trouble.
I was caught by a traffic policeman not too long ago in Delhi because my mask was below my chin. But I just want each of you, as we end, to tell me and put your thumbs up if you agree with me that all four of you believe that compared to where we were 2 or 3 months ago when we had our last COVID roundtable, we are in a better place. If you think we are in a better place, put your thumbs up. Oh, that's good. So there's unanimity on that. There are smiles finally. And maybe that in itself is the kind of positive spirit that we can take without lowering our guard. Critical not to lower your guard in the next couple of months, but move forward with a spirit of positivity. Dr. Jameel, Dr. Thakkar, Dr. Swaminathan, Dr. Sibal, as always, it's been a pleasure having all of you on the Doctors Roundtable. Thank you so much for joining us. Namaskar and thanks for watching. That was the Doctors Roundtable. Stay well, stay safe. The festive season is here. Don't celebrate too much, but you can make a small beginning. Bye for now.